Hi, good afternoon, everyone. My name is Keisha Pollack, and I'm on faculty in the Department of Health Policy and Management and member of the department's Public Health Practice Committee, who's one of the co-sponsors of this wonderful Grand Rounds today. Thank you for being here. This is the second in a series of 3 Grand Rounds that we're holding this year in 2009. Our final Grand Rounds will be on December 7th in this room, so look forward to seeing folks again. And the theme that's been constant for all of the Grand Rounds has been leadership. We've been focusing on looking at different types of leaders responding in different situations. And today we are very fortunate to have Dr. Lenny Marcus come and talk with us today about MetaLeadership in the time of crisis. I want to also take a moment to welcome those who are watching us through the live webcast. And if you have questions for the question and answer period, feel free to please respond to or send your note to maphtc@jshph.edu. So let me go ahead and introduce our speaker. Dr. Lenny Marcus is founding co-director of the National Preparedness Leadership Initiative, a joint program of the Harvard School of Public Health and Harvard's Kennedy School of Government, developed in collaboration with the Centers for Disease Control and the White House Homeland Security Council and the Department of Homeland Security and the Department of Defense. Dr. Marcus, his teaching, research, and consultation have played a major role in key national and international terrorism and emergency preparedness and response. He has pioneered development of the conceptual and pragmatic basis for MetaLeadership, which is an overarching leadership that strategically links the work of different agencies and levels of government and connectivity, the coordination of people, organizations, resources, and information to best catch, contain, and control a terrorist or some other major threat to the public's health. I can go on because Dr. Marcus is such an esteemed leader, but I just want to highlight a couple things. He was recruited from the federal government following 9/11. His work was in healthcare negotiation and conflict resolution before he became the director of the program focusing on public health preparedness. Dr. Marcus has directed numerous projects and authored papers intended to advance the development of leadership, negotiation, problem solving, and conflict resolution. He completed his doctoral studies at Brandeis University, and he was selected as a fellow for the Kellogg National Leadership Program. In his spare time, he plays the saxophone and clarinet and is a cartoonist and loves to travel. And his email address, I suspect, will be on your slides if there are any additional questions. And with that, please welcome Dr. Marcus.
Well, thank you, Keisha. And in the spirit of connectivity, it's really wonderful to be here at a sister school of public health and to share with you some of the work that we've done. So the talk today is MetaLeadership in times of crisis, and I'll focus on that, and then the and beyond is the conversation that we'll have afterwards, which is what are other applications of MetaLeadership. Now, it's always difficult to talk for half an hour or 40 minutes on a topic which one could talk about probably for 5 days straight. And so I pondered exactly what to share with you, and I decided to take you on our journey, how the word MetaLeadership came up. It started as a descriptive model, and we were using it to differentiate what we considered good leaders from bad leaders. And it went from a descriptive model to a normative model, which is to say we could describe these good leaders, and then we challenged ourselves to figure out, well, then how do you teach people to be leaders? And it was more difficult than we first imagined. We first set ourselves out to the task, and then doing it was actually quite difficult. And now we're really at the cusp of taking it the next step to an analytic model. And what I'm going to do is share with you some of that, and I'll leave you with that as a question, and from there we can have our discussion. So let me also say that I am here representing several other of my colleagues, and I want to introduce them to you because this work, this development of MetaLeadership, has been the work of several individuals working together. First, I'll introduce you to Joe Henderson. Joe was the former director of the Office for Terrorism Preparedness and Emergency Response with the CDC right after 9/11. Some of you might know Joe, and he was the original MetaLeader. Second person is Isaac Ashkenazi. Isaac is a retired colonel with the Israeli Defense Forces. He is a physician. After the Persian Gulf War, he designed the emergency preparedness and response system for Israel as the first Surgeon General of the Home Front Command. This is Isaac hiding behind a wall because the two of us are being bombarded by rockets just south of the Lebanese border on the last day before the ceasefire in the war between Hezbollah and Israel. This is Barry Dorn. Barry is an old friend and colleague. We've done a lot of work together on healthcare negotiation and conflict resolution, and if an orthopedic surgeon can figure this stuff out, anyone should be able to figure this stuff out. By the way, Barry says I, as a social scientist, live at the place where the rubber meets the sky. So this is me. Just after the first bombardment, we were in a just almost hit by the rockets that are right behind you. This is in a city in northern Israel called Tzfat. And finally, Eric McNulty, who just joined our team, had been with Harvard Business School Publishing, and he is working round the clock to take all that we're doing and to get it, helping us to get it down on paper. Okay. So let's go back to where this all began. When I first met Joe Henderson, it was right after I'd been to Israel, and Isaac hosted me for a week. This is right after the smallpox, right after the public health preparedness centers had gotten off the ground. And he invited me to come for a week, and we spent a week in a solo tutorial on emergency preparedness and response. And the specific question that we looked at was smallpox. And I wrote a paper reporting on what I had learned, which somehow got very widely circulated. It was on National Public Radio, and Joe Henderson had gotten a hold of the paper and then asked me to take him to Israel to meet Isaac and his colleagues, and we became very close friends. And we decided that I would study leadership by following Joe, and we would speak sometimes 2 or 3 times a day and visit with one another. And on December 21st, 2003, he was in his car and he called me up and he said, did you hear that the Secretary Ridge just called an orange alert? And I said, yeah. He said, I'm going up to Washington. I knew that his family was waiting for him to get home to go off on their Christmas vacation. And I said, Joe, why do you need to go up to Washington? You've got a secure cable. You can be in touch with Washington via the secure cable. And Joe said something that I think should be emblazoned on all of our buildings across the country. He said, public health needs to be in the room. And that will be the first theme, and that will be where we conclude today. Public health needs to be in the room. And I think we need to figure out what that means. So Joe went up to Washington, and he went into the room where they were sifting through all the intelligence. And if you remember at the time, they had announced that airplanes coming from Heathrow and from Paris were being stopped because there was a concern that there were bombs on those planes. When Joe got into the room, he found that, in fact, there was a very different threat scenario that they were looking at in that room. One, they were very concerned about an anthrax attack, and they thought that it could be impending. They also, according to the intelligence, were concerned that 3 cities would be hit by 10-kiloton nuclear detonations sometime in the next period. There was concern that there would be a release of a dirty bomb, that there would be release of a chemical agent, that there would be release of plague someplace in the United States, and use of smallpox in a biological attack. And Joe said he sat in that room for about a day or two, and as most of us, when we first go to a committee, we don't necessarily raise our hand and talk. He just listened. And he recognized that there was really no strategy that was being pursued. There was no way that they could put all of that intelligence together and then figure out what to do next. So he said he went back to the Washington side of the secure cable, and he assembled 6 working groups in Atlanta. And one working group worked on anthrax, one on the nuclear detonation, one on the dirty bomb, chemical plague, and smallpox. And 48 hours later, he walked back into that room, and he presented these 6 reports. And in each report, and this is taken from the report, it said, in the moment, what would this story look like? And how many casualties would be, how many injured, what would be the impact of the infrastructure, what would be the need for resources and assets, what should the president do? A whole series of questions across the top in the moment. And then he answered the same set of questions an hour later and then 3 hours, 6 hours, 12 hours, 24, and went out in intervals all the way out to 30 days. And he walked back in the room with these 6 reports and presented them there. 3 weeks later, I went down to Atlanta, and we debriefed on his leadership experience. And it was extraordinary, because here, Joe is in the Office for Terrorism Preparedness and Emergency Response, which is a second-tier office within the CDC. And of course, the CDC is a second-tier organization within Health and Human Services. And when Joe presented the report, it was picked up then and adopted by the Department of Homeland Security. And then it was picked up and adopted by the Department of Defense. And then the Homeland Security Council was in the room, and they likewise adopted it. And the people from the Homeland Security Council went back to the White House, and they presented Joe's strategy to the White House. And then that became the strategy that was used to brief the president. So when Joe told me that story 3 weeks later, I said, Joe, that wasn't simply leadership. And the word that came to my mind was meta-research. And of course, when someone is doing meta-research, they'll look at 50 or 60 articles on cardiovascular disease and ask themselves, what are the cross-cutting themes of all those different articles? And that's what meta-research is. And so the word that came out of my mouth was, Joe, that wasn't leadership, that was meta-leadership. And so we recognized that there was something unusual about what he had done, and we weren't quite sure exactly what it was. So here we had a description of good leadership, and we didn't know exactly where to take it next. And so as it began, and there is an article on biosecurity, and our first article really talks about many different silos that are involved in preparedness and response and the government, and the importance of meta-leaders to build connectivity across all those silos. And the premise there was that everyone says that they want to break down the silos, crash down the silos. And though I've lived in Boston for 30 years, I grew up in Wisconsin. And in Wisconsin, we think silos are good things. You put your corn and your hops in silos, and good things happen in silos. So we recognize that what you don't want to do is you don't want to destroy the silos. You want strong, positive, leaning forward silos. However, the problem is that those silos are not connected. And so we first identified in that first article meta-leadership as someone who connects those many different strong silos. And we didn't want it to seem as if leadership was bad and meta-leadership was good. You need strong leadership within the silos. You want the strong silo. And you also want people who can build the connectivity. So that's where we were at that point. So soon thereafter, joining our team is Dr. Isaac Ashkenazi. And Isaac is very, very well known in Israel because if you look at that picture there where he's holding that girl, he rescued that girl after she had been caught in rubble for 4 days. And it's a compelling story. It's a very famous picture. I met Isaac when he was a student in our class at the School of Public Health. Isaac led the response. You see there, that's the embassy in Nairobi. He led the rescue effort by Israel, first plane to land in Nairobi after the embassy response. So he would lead many of these responses. And after he left the army, he would go to every incident around the world. So he was in Tokyo right after the sarin attacks. The bottom there, he was in Mumbai 18 hours after the shooting began, and he was walking around during that period. He was in Sichuan, China, 2 days after the earthquake. So he will go to an event anywhere in the world, and then he encouraged us to do that. And so we, which wouldn't have normally been what we did, we started going to do on-location field research. I had met Mike Brown before Katrina, and when Katrina happened, he wrote me one of those emails. He said, Lenny, you want to study leadership? Come on down. So that's the access I had. I was literally sitting in his office, rode in the car with him, went to meetings with him, and I was able to listen in. And when Secretary Chertoff fired him, the two of us sat alone for 45 minutes to talk about what occurred. They gave me a helicopter, and I was able to go down to New Orleans. And I was there when Secretary Chertoff removed Mike Brown and then brought Admiral Allen in. And we've been very close since. About a third of the flag officers or admirals of the Coast Guard have been through our meta-leadership training. So it's been a very strong relationship with the Coast Guard. This is the satellite. Remember, about a year and a half ago, there was a satellite that was coming in to the United States, and they had to shoot it down. I wasn't with the satellite. I was with the federal coordinating officer for FEMA as the satellite was coming in, and it was a fascinating study in the difficulty between civilian agencies and defense working together. And it was almost so ridiculous that FEMA would say something, and then Department of Defense classified it, and they couldn't say it anymore. So it was a real problem of connectivity, and you had to be there to actually see it. During the inauguration, Bear and I with the head of the Secret Service and then the head of Homeland Security for the district. And then this past January, we were in Israel. This is Avi Israeli. He's the head of the Ministry of Health for Israel. And we took a delegation of CDC, Department of Homeland Security, and HHS leaders with us on that delegation. So the most recent, there were several on-site studies this year, but we were in Israel with this group, and it's significant that right down there on the very bottom, you see Dr. Rich Besser, who was the acting director of the CDC, and Greg Berlin, he was the head of the National Stockpile. And the two of them were there in January, and of course, a few months later, they had a very, very important role in the response to H1N1. As it turned out, what we learned about on this trip was resilience. Because every decision the Israelis made in regards to the Israeli population, 850,000 people were being bombarded, random rocket attacks from Gaza, everything was resilience. They had resilience centers. When they made a decision, they asked themselves, how will this affect the resilience of the population? And we spent a week very, very deeply involved in this question of resilience. And we learned a tremendous amount in the course of that week. So as we moved along, our group, we then went from MetaLeadership creating connectivity to now moving toward a normative model. And then we developed the 5 dimensions of MetaLeadership. And I'll go through them very briefly. The first dimension is the person of the leader. It's who you are. It's your personal qualities. It's your balance, and it's your discipline, and it's your ability to maintain those in the course of a crisis. Dimension 2 of MetaLeadership is the situation in which you find yourself. If it's a change, if it's a problem, the context in which it occurs, the culture, the nature of the crisis, you are in a situation. And each of these dimensions of MetaLeadership work in concert. So then situational awareness requires you as a person to be balanced and to understand and know the situation that surrounds you. Situational awareness was a critical problem during Katrina. And one of the issues was that Mike and many of the people who were in charge there saw this as a wind event. Katrina was a wind event. Of course, the hurricane went over New Orleans, and the wind didn't create that much damage. Katrina, in fact, was a water event. And if the orientation is still that it's a wind event, then they were doing fine. Bronny, you're doing a heck of a job handling the hurricane, handling the wind. And they were not doing a good job handling the water. The dimension 3 of MetaLeadership is your ability to lead your silo. And this is where most of the literature in the field of leadership is about how to be a good manager. And that's critically important. Dimension 4 of MetaLeadership is your ability to lead up. And this is where there's the least amount in the literature. It's how to be a good follower, how to lead and manage your boss. And then dimension 5 of MetaLeadership was really where we began, how to build connectivity across all the different silos of the system in which you're working. So if you look at these 5 dimensions of MetaLeadership, and we look at them individually, the 3 dimensions over there are really organizational. It's about generating connectivity and influence, leading your silo, leading up to your boss, and leading cross-sector or cross-organizational connectivity. So it's really within the organizational dimensions. The first 2 dimensions of MetaLeadership are really about your awareness. It's about you as a leader. It's about your strategy, your assessment of what's going on. And to be an effective MetaLeader, you need to be implementing and actualizing each of these dimensions together. So let's go through very briefly the curriculum for MetaLeadership, and then what I'm going to do just to give you a sample of one of those dimensions, which is dimension 1 of MetaLeadership. The first dimension of MetaLeadership is the person of the MetaLeader. And Isaac says that when he is leading the response to a crisis, he says, it's like I'm always walking around with a mirror. And he says, I look in that mirror and I see what I look like. And then I decide what the leader needs to look like in this moment, and I can make myself look like that. So he says, whenever I'm leading the response to a disaster, I make sure that I'm well rested. I make sure that my uniform is crisp and my hair is combed and I'm wearing cologne. So I said, Isaac, I can understand well rested. I can understand the uniform and the hair. Why cologne? And he says, because I need to feel that I'm fully myself when I'm leading the response. And Isaac, when he teaches in our NPLI course at Harvard. When he teaches this, he shows a picture of a world leader at a moment of when they're very happy, and then he shows their face when they're very stressed in the middle of a crisis. And he'll show a number of different people, and it's extraordinary to see the difference. And he says, the population is looking at your face. And if you look stressed, and if you look like you are panicked, they'll become stressed and panicked. And if you look calm, they will become calm. And so he says, I look at that mirror and I decide what I want to look like, and then he has the balance and the discipline to look like that. So, like holding a mirror. Dimension 2 of meta-leadership is situational awareness. And this is a tough one because leaders like to know, here's the situation, now I know what to do. It's very difficult to say, here's the situation, and it's soon going to be different. And being able to lead through those changes. Momentarily, I'll talk about the beginning of H1N1, where you have some data, you have some information, you know you're going to get more data and more information, and the situation will change. And it's difficult to continuously change because people like to hear one message. People like to know the difference between right and wrong. Leading your silo. Many times leaders say, you are my followers, you must be committed to me. The meta leader understands that first they have to show the commitment to their followers, and then they'll get it in return. Or in other words, if you're loyal to your followers, they will be loyal to you. If you're not loyal to them, they won't be loyal in return. Leading up, you must know what are the priorities of your boss, and you must lead to those priorities. The co-director of the NPLI, it's a Kennedy School of Public Health joint program. The co-director is David Gergen. David teaches a whole seminar in the NPLI on leading up. David was advisor to 4 different presidents, President Nixon, Reagan, Ford, and Clinton. 3 R's and 1 D. And what David said is you lead up not to the position, not to the president, you lead up to the peculiar personality of that boss. And he said if your boss priority is finances, go in with proposal A and talk about it in terms of how it'll affect the budget. If your boss's priority on the same proposal is reputation, speak about the same proposal in terms of reputation. Or in other words, you need to speak the language of your boss if you're able to have, and this is one of the qualities of the meta leader, influence beyond your authority. And Joe sure had a lot of influence well beyond his authority. And this is one element of that. And finally, that ability to lead across, to create connectivity. And it requires you to make other people comfortable in your domain and for you to be comfortable in other people's domain. And, federal bureaucracies, for example, have their own language, they have their own acronyms, and you feel a little bit like an outsider when you go into their domain and vice versa. And the meta leader is able to understand the language, the culture of different silos, different organizations, and is able to build and create that connectivity. So the onset of H1N1, and shortly after it was called, I went down to Atlanta, and there, of course, it was a very tense scene. Rich Besser is a graduate of Rich Besser was the acting director of the CDC at the time. He's now senior health director for ABC News. Rich had been a graduate of the NPLI, and soon I'll talk about the meta-leadership summits for preparedness. Rich came up with the idea, let's take meta-leadership around the country. And so he had developed this notion of meta-leadership, and then he was trained to teach meta-leadership. He was with us in Israel, and there he was able to see people in crisis. They weren't saying, if we were in a crisis, this is what we would be doing. They were in the middle of a crisis. We met with the Director General of the Ministry of Health the day after rockets came in from the north. And he said he was asked to order a hospital down into the basement. And it was a very big decision. And he said, I asked myself, what would affect the population of the North in terms of resilience? And he said, I made the determination that they would be more resilient if I didn't allow or didn't order the hospital to go down, because it would create more fear in the population. And so Joe was there, literally step by step. So Rich was there, step by step through that crisis. And here he had a tremendous challenge. First off, he says, okay, lead up. Who am I supposed to call? This was that first Thursday. Who am I supposed to call? There is no Secretary of Health and Human Services. There's no assistant secretaries. Who does he call up? How do you lead up? And he ended up leading up right to the president, who, the picture right down here on the bottom right is Rich. This is the back of Rich's head with the president and Secretary Clinton and Secretary Sebelius, and he presented at that cabinet meeting. I said, Rich, weren't you nervous in front of all those people? He said, why should I be nervous? I knew more about H1N1 than anybody else in the room. So he had to lead up. He obviously had to lead his own silo, and many people at the CDC said he was an extraordinary role model in that leadership, build connectivity across all the other departments that needed to be brought together. The situational awareness was very complex because there were, of course, as we know now, 70 to 90 people dead in Mexico. The virus is coming into the United States. Situational awareness was very difficult. And we've debriefed him on this, and he said that every day they had to come up with a different understanding of the situation. And part of the problem, of course, was not only having the situational awareness, translating that into policy. The fact early on that they said that 2 weeks closure for every school where there was one case, and then just 2 weeks later, they changed that policy. So the situational awareness required consistent change and extraordinary meta-leadership. What Rich said about his experience is meta-leadership helped him integrate all of those different dimensions of his responsibility. And that meta-leadership was in his mind, and it was there as he was leading simultaneously in all those different directions. Now, one of the images that we have of meta-leadership that we hope gets embedded in people's mind is what we call the cone in the cube. And this was inspired by the events of 9/11. And let me first show it to you, and then I'll tell you the story. Two different groups of people are given the task of finding out what's in that cube. Now, to you, it's transparent. To them, it's opaque. One group gets to look through peephole A. The other group gets to look through peephole B. The people who are looking through peephole A see a triangle. The people who are looking through peephole B see a circle. So they get into a conflict. Is it a triangle or a circle in the cube? Now, the people who are looking through peephole A say, do you realize how smart we are? If we say it's a triangle, it's a triangle. And the people who are looking through peephole B say, we don't care how smart you think you are. We control the budget here. If we say it's a circle, it's a circle. So they're in a conflict. Now, the reason this was inspired by the events of 9/11 is you might remember that there was terrible conflict between the New York police and the New York fire. And after the jets hit the Twin Towers, the New York Fire Department assembled and had a command center at the very bottom of the Twin Towers, and they looked up, and they had their situational awareness, and they were sending firefighters into the building to help in the evacuation. The New York police had a helicopter that was flying around. The helicopter was looking from this angle at the building. They saw that the girders where the planes hit were red hot and about to melt, and they knew that when they melted, the top of the building would fall down and the building would collapse. The New York police got on the radio and told all the police to get out of the building. Because of the history of conflict between the police and fire, they didn't purchase interoperable radios, so that message never got to the fire. So they were looking at the same problem from different angles, didn't integrate that information, and hence the problem was much more complex. So I got to Atlanta, and I'm driving from the airport to the CDC, and I called up the lead physician, policy physician at the White House. And I said, well, what's going on from your perspective? He said, we have a cone in the cube here, which is different people looking at this perspective, emerging very, very quickly, hard to determine what's going on, and we need to integrate those different perspectives. So that people were using and integrating the thinking of meta-leadership as they were trying to develop situational awareness and move forward. So let me just go briefly into dimension one, just to give you a flavor of when we have a curriculum, what it looks like. We say in our leadership class that every leader has strengths and every leader has weaknesses. Great leaders know their strengths, and they know how to balance them against their weaknesses. And we have been inspired by the work of Daniel Goleman on emotional intelligence and social intelligence. So there's an interview on the internet with Barry Dorn and I interviewing Goleman about emotional intelligence and crisis leadership. And of course, there are 5 elements of emotional intelligence. And of course, you just heard them as Isaac was explaining it. First, self-awareness, the ability to self-regulate, empathy for other people, being motivated yourself and being able to motivate other people, and then, of course, social skills, the ability to be comfortable in someone else's domain. And what Goleman says is very, very smart people have a very high IQ. Successful people have a very high emotional intelligence. And certainly when we're talking about the ability to lead in a time of crisis, emotional intelligence is critical. Another aspect of this is looking at your brain. And we divide your brain into 3 different levels. At the very bottom of the brain is your primitive brain, your old brain. And this is the part of the brain that we share with the reptiles and the rabbits. And when that part of the brain is activated, we have a triple F response. You either fight, flight, or freeze. Very, very limited. In your mid-level brain is what we call the toolbox. And this is all of those things that you've learned and that you can do almost by rote. And at the highest level of your brain is your laboratory, your neocortex. And this is where we do creative thinking, and this is where we come up with new ideas, and this is where a lot of our learning goes on. So, for example, driving your car to work. Many times you get into your car in the morning, and then the next thing you know, you're at work or at school. And so that's a mid-level brain kind of an activity. If you get into a near-hit accident, you go to your lower brain, it's activated. And if you find that you're at a traffic jam and you need to get around it, your higher level brain gets into place. How do I get around, or what alternate route might there be? Similarly, in a hospital, the way this would work out, if there's a cardiovascular arrest, they'll press the code blue. Well, people go to the basement, we say, for a moment, because somebody's dying. And then they go up into the mid-level brain. Those things that they've practiced and rehearsed, they pull out the cart. And then there are many different reasons for why someone would have a heart attack. And someone around the table will say, here's an unusual event. Go to the highest level of brain, say, here's how we need to change and modify in order to meet the needs of this patient. So we have in our brain something called the amygdala. It's an almond-shaped structure, and the amygdala is constantly filtering information that goes through the brain. If everything fulfills the patterns that we expect, your amygdala is quiet. But if all of a sudden a boulder were to bang into this room, we would all jump, our amygdala would become activated, and we're sent to the basement. And the basement is that lower level brain where the triple F is sparked. And when you're in the basement, it's very, very difficult to lead. If you do lead, you'll oftentimes create mistakes. We have many, many opportunities to go to the basement every day. You're running out of the house, you open your wallet, there's no money in it, your significant other has borrowed some, right? Or you can't find your keys, or your child is crying. There are many things that will send us to the basement. Now, there's nothing wrong with going to the basement. Going to the basement is a survival mechanism. All of our forebears, when a tiger came upon them, went to the basement and ran really fast. Those people who didn't run fast, their legacy is not here. So going to the basement is in part a survival mechanism. What a leader needs to do is to get out of the basement and to get into that mid-level brain where you're beginning to activate your responses. And as you're activating your responses, things that you've drilled or exercise, your training, connectivity, you will get the system going. Isaac tells a story that he was driving along and he came upon a building that had collapsed and everyone was in the basement. And so he ran over there. He was in the basement too for a second. He got up and he started giving everyone orders. You move that piece. You go call the police. You go back to your home and make sandwiches because you're creating a panic here. He gave everybody a job. And then once the system was operating, he was able to go to the highest level of his brain and do what the U.S. Air Force calls the OODA loop. And fighter pilots, the best of fighter pilots, are able to implement what's called an OODA loop. They observe what's going on, they orient themselves, they make a decision and act. And the faster you go through the OODA loop in a crisis, the more effective you will be as a crisis leader. That's what happens in the crisis. So what you're doing in preparedness is you're designing the patterns that you'll activate in the middle of a crisis. If you haven't created those patterns, you have no place to go. You will be in the basement, and you will stay in the basement. Joe has a great metaphor. It's like when you go down to the basement, it's like everyone around you is on an escalator going down. Not only do you have to walk up against the escalator that's pulling everyone down, people are pushing you down as well. So you need to get up out of the basement, and then you need to lead people out of the basement in order to get the system going. We call this working with your brain, and it's really at the core of dimension 1 of meta-leadership. A few applications, and we're close to the conclusion. One of the projects that we've developed, and again, this was the brainchild of Richard Besser, what are called the MetaLeadership Summits for Preparedness. They are put together by the CDC Foundation in Atlanta. The money, the support for it comes from the Robert Wood Johnson Foundation, coordinated through the Center for Disease Control, and Barry Dorn and I serve as faculty for these summits. We're doing summits around the country. We've already done summits in these locations. I was last week in North Carolina, and from here I'm going out to Minneapolis. We're doing our MetaLeadership Summit for Preparedness in Minneapolis. And what we're doing is bringing together 3 sectors: the public agencies with the private sector, so there'll be Target and a number of other General Mills, businesses coming together, along with nonprofit organizations. The premise being, and this really emerges out of the lessons of Katrina, the premise being that these sectors need to work together in preparing so that in the middle of a response, businesses that want to help can help in a constructive way. Nonprofits will be able to link up and be helpful, and that connectivity in a major crisis will be a plus for the community. Finally, and this is where the thought that I'll conclude with, the question of resilience. Oh, I know people like numbers, so these are the latest numbers that come up before we go on. The CDC is doing continuous evaluation of the MetaLeadership Summits independent of us. There's a group doing this. They're doing fabulous work, and they just did the evaluation of 3 summits: Illinois, Boston, and Dallas. 87% of the respondents reported using meta-leadership concepts or principles since the summit. This is 6 months out, and 94% report that it's made a positive difference for them and their organization. So the whole intent of the curriculum is that it has stickiness, that people learn it and then they use it. So resilience, population resilience, and meta-leadership. We know in a catastrophic emergency, normal population function is significantly reduced. This, of course, is Katrina. And immediately you want to save lives and property. You want to restore normal functioning as quickly as you can. Then how do we think about resilience? How do we make a population resilience and think about population resilience? Well, we know that before a crisis, people are here, and then they'll be taken down in terms of their functioning. And then the question is, how do we get them back up? One pattern could look like this, where you're still a big gap between where you were before and where you are now. And another could look like this, where people get back up and going very quickly. Here, they close the gap very, very quickly. Here, a very, very wide gap, and it's closed very slowly. This could be Katrina, and as we've studied the response in Israel, they're very, very quick to get things back to normal after a suicide bombing or after any kind of an event. So we're trying to understand this notion of resilience. And we know there are phases. If you're going to plan for and enact resilience, in the preparedness phase, you need to build connectivity, what we're talking about with the MetaLeadership Summits, very, very good communication, cone in the cube, and you have to make sure you know where your assets are so you can activate them. Immediately after, you have to have an effective evacuation, life-saving, property-saving. This usually is where the responders, emergency response is. And then beyond that, shelter and feeding, and also getting people back to their home. It's not just staying in the shelter forever. It's being able to deal with the stress of the event, and then, of course, being able to reassure people. And then in the long-term rebuilding, getting systems back in place and creating confidence. We're fascinated by the fact that this has become a new topic of interest here in this country. The Obama administration has created the Resilience Policy Directorate within the White House Homeland Security Council. 2 of our graduates are staffing that and are really opening this question of what does it mean to build population resilience? How can that be part of our preparedness and response? And the premise being that if you're oriented toward resilience, you will prepare differently, you will respond differently, and you'll have a very different impact on the population. And I think that this is an area that's in the province of public health. We don't run in the middle of the emergency to pick up stretchers. That's not our responsibility. However, population resilience is very much part of our responsibility. We had a MetaLeadership Summit last week in North Carolina, and for the first time, at every summit we have a scenario. And for the first time, the scenario was resilience. North Carolina has a lot of experience with hurricanes, and they're very good at it. And they drill and they exercise. The scenario we had, it's 7 days after a Category 4 hurricane. How do you build resilience in the population? And the interesting thing is many of the first responders didn't even know what to do with the question. They said 7 days after Category 4, we're sleeping. We've been up 24 hours a day. We're tired. We can't do anything anymore. And as I was looking around the room in the breakout group that I was a part of, the public health officials understood what resilience meant. They were able to talk about, this is where we can come in, this is where we can play a role. And I think that this is really a whole new frontier for us to think about what does it mean to help a population be resilient, whether we're talking about a natural disaster or an H1N1, or we're talking about terrorism or a major accident. How do we help a city? How do we help a state? How do we help the country to be resilient? And this really is a question for us right now. So I'll leave you with questions. And these are the questions that we're dealing with and that we're looking at right now. Every one of us has been through a personal crisis, whether it was a death in the family or some sort of financial problem or a divorce. Everyone has been through a crisis. And thinking about members of your family, some people were resilient and some people were less resilient. So how do we understand personal resilience, and then how do we translate that into a system being resilient, and then how do you create policies and practices that can help us be more resilient? Some of that is immunity. I mean, we have physical immunity if we've been exposed to a virus or if we've been given a vaccine. That builds immunity for us. And as we look at other countries and other places that have had terrorism and other major incidents, the population builds immunity. We don't have much immunity in this country in terms of the population. How do we build immunity in lieu of the actual event so we respond better? What are some of the wider applications of MetaLeadership? I'll throw this out to you. Could it be helpful in looking at other public health issues, from tobacco control to other issues that we're concerned about, where MetaLeadership could be important? How do we build confidence? Right now we're having somewhat of a challenge in confidence because there were promises of many doses of the vaccine and confidence and credibility, and then how does that play into our thinking about leadership and meta-leadership? What's the opposite of meta-leadership? This is something that we've been toying with because we know what a meta-leader is. What if you're not a meta-leader, and what do we call it and how do we think about it? And so with all that, it's been a pleasure. I think we're now going to have our panel, and happy to entertain your questions, even more interested in some of your answers. Thank you very much.
So thank you very much, Dr. Marcus. I think I can speak on behalf of the committee that when we were planning for this Ground Round series, I don't think in our wildest dreams that we could have thought of a better talk than what you just delivered. Really integrating so many of the elements that we all embrace, but rarely are we able to put them into practice in the way that you have. So thank you very much for that. So as Dr. Marcus said, we're going to move on now to a panel of respondents. So we have 3 respondents who really exemplify leadership both here on campus as well as in our field. I'll introduce each of them individually, and then they'll take a seat up here on the table. They're going to spend about 5 minutes making brief comments to Dr. Marcus's talk, and then we'll open it up to questions both from the audience here in East Baltimore as well as from the audience around the world. So our first respondent is Dr. Tom Burke, who is the Associate Dean for Public Health Practice and Training and also a professor in the Department of Health Policy and Management. Tom is, as I said, a leader on campus and has a distinguished history of leadership in the field of practice as well, and is an inspiration to us all who want to better integrate the scholarship that we do here at the school with the practice that we so desperately need and admire of those who work in the field. So Tom, I'll turn it over to you.
Are you that was outstanding. All my life I've been able to take notes on cards and really figure things out, but there was so much content there that I filled my cards. It was just a great talk because it broke down things that I've been thinking about and I've been living for a long time in such a logical sequence. And as you were talking, I was struck by the logic of it and the wonderful sequence and steps of knowing yourself and knowing the situation. But the thing I liked best was that you said public health at the table and the unique role of public health in these things. But at the same time, I was going through the steps and knowing the actors and living through and seeing both having been involved, not to the incredible level that you have been involved in the front seat, but having been involved in many of the responses to failure, watching the CDC during anthrax and being on the advisory committee to Jeff Copeland, who some might say had failures of MetaLeadership within the organization that brought us to question the leadership in public health, and being there for the briefings where, as you mentioned, with FEMA and the Defense Department, where the FBI couldn't talk to the CDC because of the lack of that connectivity that you talk about is so important. So on the one level, what a terrific paradigm, and we should all get that kind of training. On the other hand, there must be organizational impediments that we have to identify so that we can actually make it work for CDC, for HHS, and for our local health departments. I was thinking here of the Maryland experience with the vaccines, even here at Hopkins, in the decision-making, just how tough, but also the situation awareness of how we had to change and constantly adjust, particularly when there was such a shortage. I think that's a great framework to lay out now. The challenge for us as a school and for us as a practice community is to translate that into, one, training for our leaders, but then looking at the organizational impediments. Because I used to manage some of those silos, and boy, they are really hardened silos. And as I'm sure that you know, for some reason in this country, the connectivity is almost designed to be very difficult. And as we think about moving forward, I think the challenge will be breaking down the silos and having people understand the role of public health, because we've all seen the tragedy of the New York City Fire Department and police department there, but on the day-to-day level of public health practice, we see it every day. And another thing I just wanted to end with is that what a great model for public health management in general. It doesn't have to be a crisis, and things don't have to be on fire for this to work, and particularly in complicated organizations like the CDC. Wouldn't it be terrific? And then as we get into discussion, I want to raise some things like, I'm really glad that Dr. Besser is with ABC. He's a great spokesperson for public health, but wouldn't it be nice to clone him and have a whole bunch of folks like that at the CDC? Because we've all seen CDC and HHS and EPA and other agencies that were called upon, and particularly our local health departments, really be in need of that kind of leadership. So I'd like to get your inside scoop. I'd also love to know what you said to Brownie, because we've all seen that and then studied that and presented it in classes as a man with almost impossible task. It was great to see the cube, the cone and the cube. What a great way to really present different ways of looking at the same thing and how those silos might see the world. So anyhow, I'm looking forward to the discussion, and I'd love to know what you said to Brownie. I want to know how you get all those helicopter rides, because I'm very fond of those kind of things. But then I'd like to examine a little bit. So here, we're pretty smart people, but we haven't been in the driver's seat in this kind of crisis response all that often. And if we're going to be at the table, we have to adapt as educators, as public health researchers as well, not just our leaders in the agencies. And I'd like to explore a little bit how we break down that academic silo too, so that we don't see a problem and just research it, but that we actually get out there in the front lines and help with the response. So I'll stop there.
All right, thank you, Tom. So our second panel respondent is Dr. Michel Ibrahim, and he is a professor here at the school in the Department of Epidemiology, and he comes to us from the University of North Carolina, where he served as both a professor and a dean and had a very distinguished and accomplished career down there in the practice world. So Dr. Ibrahim, thank you for participating today.
Thank you very much. Thank you, Dr. Marcus, for offering us lots of lessons we can learn from, and a very nice talk. I'm going to just take a couple of your lessons and expand them and give some examples from personal experiences in public health. The first lesson is thinking outside the silo, think outside the box, in a sense. And I remember when, a public health example, when I was Deputy Health Commissioner, Erie County, Buffalo, in the late 60s. Would you believe that? In the late 60s, a long time ago. And we were threatened at the time, like we were threatened now by H1N1 epidemic. We're threatened by the German measles or rubella epidemic. And it was very much like H1N1. Wasn't really that serious. It's a very mild disease, skin rashes and lymph nodes problems. However, if it affects women in the childbearing age, there's a risk of having children with congenital abnormalities. That's why it was very serious. So the vaccine was just in the late 60s was being produced in a hurry to deal with this epidemic, predicted epidemic. German measles comes in cycles, or used to, every 6 to 9 years. And in the late 60s was the time that it might happen. So we wanted to get the vaccine. However, we learned that the vaccine, when it's produced and tested, had some arthritic implications, especially in women. So we wanted, before we go out in the whole community and vaccinate everybody, including women childbearing age, we wanted to make sure that the arthritis is not really severe. Well, anyway, we wanted to have a sample of a couple of hundred women who would promise, who are not pregnant, or promise not to get pregnant during a month during the vaccination. So I went to the head of the nursing staff at Erie County Health Department. We used to have about 400 nurses, and I told her we'd like to test the vaccine on arthritis, and we want to make sure that people would either not pregnant or promise not to get pregnant. She said, well, you shouldn't really find another population. There is no way for us to promise you this kind of promise. So thinking outside the box, I said, I'm going to go to the Archdiocese of Buffalo and ask the Mother Superior if she will volunteer a couple of hundred nuns to take the test. And she said, we are here to help the community, and we will volunteer. So I went next day, I went to 200 nuns in the meeting like this, and I told them about why we wanted to do this, and they all agreed, had almost 100% acceptance to have the vaccine tested on them. There's a catch, though. We gave them a questionnaire to fill out, and at the end of the month after the test, we got almost blank questions, and we're told that nuns usually do not complain. So we decided that if they're really serious problem, they probably have heard some complaints. And from there on, the vaccine came and we tested it, and we had very mild problems. That's the first lesson. The second lesson, thinking across silos. I have a little bit of trouble with that because in our culture, whether government culture or academic culture, we are trained and rewarded by thinking in silo. That the head of the Department of International Health was hired by the dean to make the department the best in the school and the world. he or she will not have any ill will about epidemiology, but he's not really interested in promoting epidemiology. You're not hiring him to promote. So when you ask him or her to think across, that becomes it's against the grain and required courage to do that. And the example I use in going against the grain was in, again, another epidemic, AIDS in the early 80s. And one of the preventive measures at the time was to use condoms as a preventive measure. Most of the world was using them, and this country was kind of very careful about it until Everett Koop made condom a household word, and everybody began to talk about it. But at the time, I was chairing the University Council on AIDS, and our committee recommended that we should put condom machines in women and men's dormitory. So we made the recommendation to the chancellor to go against the grain and recommend that. And he had 6 months to go, and he said, no, well, leave this one to the new chancellor. It's a very important problem. The new chancellor came, we made the same proposal to him, and as soon as we made the proposal, the whole community, the university said, you are really going beyond what you're supposed to do. Our kids come to school to learn and to study, not to use condoms in the machines, and you shouldn't do that. We were kind of, the committee was criticized severely, and we needed someone to go against the culture and the grain about that condoms are not really promoting sexuality, they are used as a preventive measure. The new chancellor, and that's when the courage and going across the grain did. He said publicly, he said, I am the son of a Baptist minister. I don't like the recommendation whatsoever about putting condom machines in dormitories, men and women. However, if the scientists and the doctors tell me that condoms are a preventive measure and has generally nothing to do with sexuality, and if it saves one student's life, I am going to go for it and accept your recommendation and institute what you have recommended. And that courage and going across the grain by this particular chancellor did the trick. Nobody has criticized the machine. The machine will put in and be used in the whole dormitory. So the first lesson is thinking outside the silo and be creative. It's doable, except that you have to think through it carefully. Thinking across, I have a little bit of a problem because we are training our people to think down and make sure that my department is the best department. And probably, eventually, Tom might talk about this as a director of a public health practice with departments. If they really take your advice and think across connectivity, public health practice will be a very important program. It is, but it's very hard to get the chairs, and I don't blame them, because you hire them to do a good job for their department. So thinking across in a meta-leadership is a wonderful concept and a wonderful proposal, and I look forward in the years ahead to see it really work. Thanks.
Great, thank you. I just want to remind our listeners over the internet that the address for questions is maphtc@jhsph.edu. And then our third respondent today is Dr. Jonathan Links, who's a professor here at this school and wears many hats, which we are all grateful for. He's, in addition to being a professor, is also the deputy chair in the Department of Environmental Health Sciences. He's the director of the Center for Public Health Preparedness, and he's also the deputy director for the Office of Critical Event Preparedness and Response, commonly known as CPAR. So, Dr. Links.
Lenny, awesome. Thank you. What I'd like to do is highlight three key distinctions that came to my mind as I was listening to Lenny's talk, and then briefly mention a couple things we're doing here at the school that I think might be relevant. So the three key distinctions. The first is the distinction between being a manager and being a leader. And I think it's absolutely critical these days to have that distinction in mind, and for leaders to act like leaders instead of thinking that acting like a manager is sufficient. And I think you've, in essence, raised the ante for acting like a leader in terms of meta-leadership, in terms of influence in addition to leadership, and in terms of connectivity. So that's the first distinction, is management versus leadership. The second distinction is what I'll call KSA versus KAP, actually terms we use here in public health all the time. So KSA is knowledge, skills, and abilities, and KAP is knowledge, attitudes, and practices. And I think there's a reflex reaction, whether you're frankly talking about a manager or a leader, to focus on KSA, knowledge, skills, and abilities. This is what being a good leader means. You have the knowledge, skills, and abilities to be a leader. But actually, what we always care about in public health, we don't care about KSAs in public health, we care about KAPs, knowledge, attitudes, and practices, because we know that it's knowledge and attitudes that drive practices, not just knowledge alone. And it strikes me, as I was listening to you, that in terms of leadership training, the thing that's nice about your model is that it doesn't focus exclusively on knowledge, skills, and abilities, but emphasizes practices as the outcome and recognizes that that's a combination of knowledge and attitudes, or knowledge, skills, abilities, attitudes and beliefs, and behaviors that then drive the practices. So again, this distinction between sort of just knowledge and abilities on the one hand, and knowledge, attitudes, and behaviors driving practices on the other. Then the third distinction I'd like to make is the distinction between emergency management and crisis management. And the old-fashioned traditional world of emergency management, which frankly is what I think we've been saddled with until recently, is, to me, what's driven the old-fashioned way of thinking that you're trying to do away with. And if you think in those old-fashioned terms, you think, well, an emergency, it's a weather event, or it's a train car derailment with the release of chlorine gas, or it's, even an act of terrorism, an emerging infectious disease, whatever you think it is, you say, okay, it's an emergency, and I'm going to manage the emergency. And somehow, managing those emergencies takes a different set of approaches than crisis management, or managing the daily things that arise in any setting, for example, at a university. And in fact, when you examine the skills, the attitudes, and the behaviors that are necessary for effective crisis management, they're the same darn things as are required for effective old-fashioned emergency management. And this artificial separation where a certain group of folks and a certain group of policies and procedures are directed at old-fashioned emergencies, and a different set of folks and a different set of policies and procedures are directed at more, quote, routine crises, attacks on finances, attacks on reputation, that sort of thing. It's a very counterproductive way of looking at the world. And the same sort of people who should be involved in attacks on finances, business continuity, reputational threats, and so on, are the folks who actually are best situated with the proper training to be the ones dealing with the traditional emergencies. Or said the other way, we need to sort of up the ante on the folks dealing with the traditional emergencies, because the people who do so well on things like reputational and finance threats would also be the people who do well on the other type. And it seems to me one of the nice things about the meta-leadership approach is that from a cultural perspective, it tends to be targeted at the true leaders in organizations, those who don't normally think of themselves as the emergency managers. And so it's a way of bringing the true leaders into the fold of emergency management, but the way to do it isn't to bring them backwards that way, but to move the discipline of emergency management into today's world of crisis management. So that's the third distinction. Two things I want to mention that we're doing here at Hopkins that speak to some of the things you brought up. The first is that we've developed a model of disaster mental health that goes remarkably along with some of your last slides. So our model of disaster mental health parallels the three big stages of any disaster: before the disaster, during the disaster, and after the disaster. And in the old days, there was an almost exclusive focus on what happened from a mental and behavioral health perspective after the disaster, and that's the period of recovery. And so things like post-traumatic stress disorder as an outcome where you want to then improve recovery by dealing with it, sort of what was the focus of mental and behavioral health interventions. What you've been talking about with resilience is what occurs during the event. And there's now a number of efforts underway to increase the resiliency of a population during an event, and things in addition to some of the things you mentioned, like psychological first aid, for example, something we're heavily involved with, are ways of increasing the population's ability to spring back on the fly during an event. To us, potentially the biggest payoff is what can be done pre-event. And you use the term resilience, as many people do, to also cover the pre-event phase as well as the event phase. We prefer the term resistance. And I was delighted to see you talk about immunity, because we think of resistance as psychological immunization. And how do we build psychological immunization, psychological resistance pre-event? You know, in the world of Homeland Security, it's called target hardening. But instead of making a building more bomb-proof, we're making people more psychosocial distress-proof. And the reason I'm bringing this up now is one of the key elements in building pre-event psychological resistance is confidence in leadership, another thing you brought up. And the way you build confidence in leadership is by actually increasing the competence of leadership. And so I think it goes back to your MetaLeadership approach, because what you're basically talking about is building competence. So this disaster mental health model that we've developed, I think, goes very nicely with what you're talking about. There's one other model we've been thinking about that I think also goes along with some of what you presented. And we've been trying to think about what would it take for us to say that a community was prepared. What does it mean to be prepared? And it dawned on us that the common expression ready, willing, and able might provide a clue as to the different elements of preparedness that are necessary to be fully and completely prepared. And I want to harken back to a comment I made a moment ago about this what we think is an inappropriate, exclusive focus on knowledge, skills, and abilities. You really have to go beyond that. So if you look at the world of disaster preparedness and how do we get professionals better prepared, it's been an almost exclusive focus on training. Oh, if only we could impart more knowledge, skills, and abilities to first responders, to public health professionals, and so on, then the community will be better prepared. So if you have ready, willing, and able, if we do all of that, that only hits the able part. Well, we've done a lot of work here, gained some notoriety for a series of surveys looking at willingness to respond on the part of public health and public safety professionals. And as everyone knows, just anecdotally from the Katrina experience, if nothing else, it had nothing to do with training or ability to respond. It had to do with willingness to respond on the part of first responders that limited, in some circumstances, the response. Responders weren't willing to show up for a variety of reasons. You can train all you want. You can impart all the knowledge, skills, and abilities you want, and it has nothing to do with willingness, which is attitude and belief driven. Then the concept of readiness, you also touched on. So to us, readiness has to do with infrastructure and support. And for a system, for a community to be ready, willing, and able, the interventions for able, the interventions for willing, and the interventions for ready are utterly different because they really address different components of what it means to be prepared. So I was very much delighted when you touched on some of those issues. So I hope we have a chance to talk more about all of this. Thank you.
So we're now at a point where we can take your questions. So if anybody would like to start, now's your chance. We've got a wonderful panel of experts here. Yes, please.
I was hoping that you could speak a little more specifically about tools to build connectivity and specific examples.
I'm going to repeat the question both for our web audience and to make sure that everybody can hear. So the question was if you could speak specifically to tools to achieve connectivity.
Well, that's a great question, and what we're experimenting with in the MetaLeadership Summits for Preparedness is how to build that connectivity. One of the things that we've noticed is that in the emergency management community, everybody says, don't wait for the disaster to exchange your business cards, right? That's the old maxim. One of the things that I didn't talk about today, and this really goes to everything that you said, and the comments were extraordinarily rich, is what are called guiding operational assumptions, or GOAS. And I'll take apart each of the words. Assumptions is what you believe to be true, or the data that you bring to the table. For example, evidence-based medicine, about 10 years ago, became a big thing. Well, what was being done before that, right? So making sure that everybody is using the same data, that has the same assumptions, the same beliefs. So assumptions. Operational is that then how do you put those assumptions into practice? Because if one person is looking at one set of data and another at a different set of data, it's the cone and the cube. They'll come to different conclusions. And then guiding means that you need to be leading in the same direction. So the guiding operational assumptions of the different organizations or agencies or sectors that have to be working together have to be clarified before an event, and they have to be clarified during an event. So one of the problems during the beginning of H1N1 is that different organizations were looking at the situation and coming with very different conclusions as to what was going on. And it was important that the CDC established and that President Obama then reiterated a number of times, we will follow the science. So the assumption was, what's the data? And once we know what the data was, that will translate into operations. If the data changes, then the operations will change. If the operations change, then we have to lead differently. And so it's important for everyone to understand that it's not simply leading out of fear, which is something that people do. They're very afraid, so they just jump at anything. They're leading from the basement. That you have to clarify guiding operational assumptions. You have to create a platform upon which you have that conversation. If that's clear, then I know what your job is, and you know what my job is. And I'll respect your silo. I won't jump into your lane, and you're not going to jump into my lane. And what we found in working with different agencies, if the two agencies can look to one another and say, I want to make you a success. How can I help make you a success? And if you come to me and say, I want to make you a success, and we're using the same guiding operational assumptions as a platform, then we're all moving in the same direction. If we use different guiding operational assumptions, we'll both look at the same situation and we'll come to different conclusions and we'll lead against one another. And that's where the biggest problems occur, and that's where our biggest opportunities for connectivity to come. So we say the old maxim, don't exchange business cards in an emergency. The new maxim is don't build your guiding operational assumptions in the middle of an emergency. Make sure you have them in place beforehand.
Yes, sir.
Yes, I was struck by the composition of the team that developed the MetaLeadership model that was comprised of military and civilian individuals. I was just curious, I actually have two questions. One is, what do you think of the feasibility of the MetaLeadership model in a military context, which is traditionally a top-down, very hierarchical, inherently siloed model? And how do you think that the MetaLeadership model can translate into civil-military collaboration?
So can I just repeat the
sure,
question?
go ahead.
Sure, thank you. So the two-part question, the feasibility of the model in the military population, as well as the feasibility of the model in civilian-military interactions.
That's a really important question, and you're right, it's an odd group of people we are. Just to give you a very concrete example, Barry and I were invited to meet at NORTHCOM with the generals who lead NORTHCOM and NORAD. NORTHCOM is located in Colorado Springs, and this is the part of the military that has civilian responsibility within the United States for a major incident, and it's also the part of the military that would respond to any kind of an incoming missile or incoming attack that would require a military response. And we met with all the generals, the 4 stars, the 3 stars, they all came together, and we gave them a seminar on MetaLeadership. Well, I'll tell you the truth, we were pretty nervous. They instantly recognized it, and they instantly understood the utility. Because while NORTHCOM and NORAD have responsibility for a certain set of missions, their accomplishment of those missions requires them to work with other sectors of the government. For example, NORTHCOM was activated in Fargo, North Dakota, as the floods were occurring there. And they can't go in and accomplish their mission without building connectivity with civilian sectors, with other parts of government, with other jurisdictions. And so the leadership there recognized that if they're going to succeed in their mission, they won't succeed because of the command and control within the military, they'll succeed because they're able to build MetaLeadership out. The other thing that they recognized is jointness, Joint Chiefs of Staff, has become very popular within the military, and it's something that's relatively new in the history of our country. And many of them said, well, MetaLeadership is to the civilian side, and our interaction with the civilian side, what jointness is to the military side. And they recognized the importance of being able to work together years ago. And as we've been working with people in the White House, for example, they've said, well, it would be great if MetaLeadership could catch on the civilian side the way jointness catches on, and that when the civilian and the military need to be working together, that they'll have a language or they'll have a way of framing the importance of having that connectivity in place.
Thank you. Were there any comments from the panel that?
The one thing I couldn't help but reflect on while you were talking is NIMS and Incident Command. So for those of you who don't know the acronyms I'm referring to, so NIMS is the National Incident Management System, and part of it was created by a presidential directive, and any government agency at the federal, state, or local level that receives preparedness funding must be, quote, NIMS compliant. And one of the hallmarks of being NIMS compliant is that you use a standardized incident command system. And so during emergency response, you can go to any emergency anywhere in the country, and you will see this very standardized hierarchical structure with an incident commander and a safety officer and a public information officer and so on and so forth. It's a very regimented approach that really fosters interoperability and connectivity. And what I was thinking of is our ongoing attempts here at Hopkins to implement a NIMS-compliant ICS at the university level, the campus level, and the school level. So the School of Public Health, we actually have a NIMS-compliant ICS. At the other extreme, the university level, we now actually also have a NIMS-compliant ICS, but it's only because of H1N1 and the need to have some sort of an incident command at the university level for it. And so I said, well, let's make it NIMS compliant and sort of explain the interoperability with Baltimore City. And we have a new president who's very much into preparedness. And for H1N1, it doesn't help that much to be NIMS compliant. But for a shooter on campus, It's really important that University Incident Command matches and is able to interact efficiently with City Incident Command. And so I actually think as organizations realize the importance of interoperability, the fact that there are these mandated models, at least in certain sectors, of interoperability is actually going to promote the connectivity that you're talking about.
And with ICS and NIMS, you also need leadership. And the distinction that you made earlier about there is management, and that's critically important, and you still need leader. The leader needs to have that influence. The leader needs to get out of the basement. The leader needs to have good situational awareness. And the leader needs to be a good role model, and people will follow that. So it's MetaLeadership versus ICS. It's really, how do we make MetaLeadership more than just management? Your point was wonderful.
So just to highlight that, back again to the university's incident command system. So we have an incident command group, and we also have a leadership group that makes top-level decisions beyond the incident command group for exactly that reason.
Right.
So I wanted to ask you about politics. You know, I was an emergency responder and ran programs that had to respond things in a state government. And there could be good leadership in the public health trenches. There could be good leaders in the police and the other responders. But ultimately, some persons who are perhaps elected and had no concept of meta leadership would make the ultimate call. And so how does this work in the politics of the situation, or is that part of situational awareness?
Well, many times the people that have been through our program and the people that we meet with are subject matter experts, and they know how to deal with a fire, or they know how to deal with a public health emergency or law enforcement problem, and they're leading up to someone who's not a subject matter expert. And so that's where the influence beyond your authority comes in, and that's where, for example, David Gergen has been so helpful in filling out that notion of leading up, because he talks a lot about a subject matter expert and a political figure working together, and that you need to really understand that person above you and speak the language of that person. You can't assume, I'm the expert, here's what you're supposed to do, they're going to do it. In fact, it's usually the opposite. They'll do something that speaks to politically what makes sense to them, rather than the advice of and they'll oftentimes have a political advisor that's a wall between the subject matter expert and the elected or appointed official. And the subject matter expert has to expect that and not be surprised by it. And the subject matter expert also needs to understand that their role is to educate, to inform, and to prepare that elected official. Otherwise, the elected official will compound the disaster. And without naming names, there have been many instances in which the subject matter expert looked up, and you can watch the videos.
Right.
And the elected official is there to get attention, to show that they're in charge, and then you look at the videos, and the elected official is in the basement. And it's written all over their face, and they're saying things that are only complicating the situation, and the subject matter expert is having a hard time controlling them. And you can watch on some videos, you can actually see that dynamic happening. And what you need to do is to prepare the political figure or the leader, or it could be a university president, for what they're going to be dealing with. And they need to know that. And they need to be told that you're going to go in the basement, and I'm going to help get you out. And if they see that you're performing that function, they're more likely to cooperate with you. And if not, they're just going to go off and do their own thing.
Yes, in the back.
I think a lot of light is given to the leader, but we all know that great leaders, they would not have done what have they done, for example, Napoleon or let's say Nelson Mandela or Gandhi, without their assistants. Usually they had, and actually they had very great assistants. I don't know, I'm asking, usually the leaders, they either make a good thing or they make a mess, and they have to clear it, in both sides, they usually, the brunt and the burden is on them. Just if you can comment on their role in this model and connectivity.
First, that's a great question, and for a few points. when...
Repeat the question.
What? Oh, repeat the question. Oh, please, repeat the
So to paraphrase, the
Dr. Ibrahim gave a good model, an example about that, when he talked about the condom and how to convince the chancellor, yes. Yes.
Good, okay. So the question, to paraphrase, is the role of assistance in this model?
Yes.
Okay, thank you.
What did you want to? When Admiral Allen took over the response to Katrina, this was a very, very difficult assignment. And I interviewed him while this was going on. And I asked him how he did it. And he said he has in the back of his pocket, metaphorically, in his mind, a list of people that are dogs that hunt. And he says, when you go hunting, bring dogs that hunt. And he said that over his career, he's found extraordinary performers, and those were who he recruited. And he said when he was asked to take the job by the president, one of his conditions is that he could bring along any of his dogs that hunt. And he picked people from around the government. And you walked in there, and they were extraordinary performers. That's number one. Number two, one of our colleagues at the Center for Public Leadership at the Kennedy School, Barbara Kellerman, has written a book called Bad Leadership. And she said, everybody writes books about great leaders. Nobody writes books about lousy leaders. And and it's a book about Hitler and Mussolini and leaders who've done bad things. And she says that when she got done writing the book, she hadn't really answered the question for herself. How could these bad things happen? So she wrote another book called Followership. And she came to the conclusion that bad leaders are able to do things because followers are willing to go along. And Hitler probably never killed anyone. And yet many of Hitler's followers were willing to go along and do his evil doings. And what Barbara says is that we spend most of our lives as followers, not necessarily leaders. And that just as we have to learn and teach leadership, we have to learn and teach followership. So to answer your question, followers, dogs that hunt, can help a great leader do great things, and followers who aren't willing to speak truth to power, who aren't willing to challenge their leaders, can help their leaders do very bad things. And that we have to better understand what followers are as well, and of course, which goes back to the subject matter expert interface with the political leader.
All right, so we're actually at time. I have a question from our web audience, though, that I want to take, and then I'll invite you to move our discussion out to the reception area where we have some nice snacks and we can have additional conversation. But again, just to end, a question from one of our web audience members is, what type of training specifically for leadership is taking place locally here in Baltimore and Maryland, part one? And part two, are there training seminars, CE credits, or courses that will help train leaders? So, anyone can respond to that?
Well, I'm pleased to say that we had a MetaLeadership Summit here in Baltimore, so that's the first thing. Here at Hopkins, we have a variety of centers that are doing training that's relevant to the discussion at hand. The Mid-Atlantic Public Health Training Center, of course, Mid-Atlantic Health Leadership Institute, the Center for Public Health Preparedness, and so on. And I think in addition, the way I look at it is Lenny's visit is a way for us to use the activities to date as a springboard to take a greater focus on leadership training. I also very much like the followership training idea as well. So we've already had a variety of seminars and trainings. Frankly, some of those are available online for free to anyone who wants to get at them through our websites. But I think this is an opportunity to actually do more.
Absolutely.
That is an important question because the infrastructure for training is still very much in need, particularly during these times that the agencies are facing budget crises and frankly, manpower crises during H1N1, where it's very difficult to let your workforce go even to training. But a very important question. Hopefully we're building capacity for that, as are our sister schools.
Just a quick question.
Yes, please.
How does your model differ in responding to an H1N1 epidemic compared to responding to a terrorist with a terrible weapon? The same thing applies, or different?
Well, it is many of the same elements, and that's where situational awareness is so important. And in terms of speaking to a terrorist incident, if, for example, we look at what happened in Mumbai, and there was very, very poor situational awareness, and as a result, the response created a disaster on top of the disaster. And here in the United States, we have not a lot of experience with terrorism, and so we're hoping to create as much exchange so that people in this country can learn from the experience of other countries. We have a project through the NPLI called The Tale of Cities, in which we bring people from India and Pakistan and Israel and Madrid and London to meet with their counterparts in the United States. And there's a lot that's been learned through those that would change how people are responding here. Terrorism is very different than a naturally occurring event because someone is intentionally making it happen. And Al-Qaeda generally uses simultaneous, thematic, and multiple. So when something happens, good chance that it'll happen again. And that can become very unnerving for people. So the meta-leadership model can apply to both, and that's where situational awareness, getting out of the basement, can be so critical.
Great, thank you. Well, again, please join me in thanking Dr. Marcus as well as our panelists, Dr. Burke, Dr. Ibrahim, and Dr. Links.